Nearly 1,100 new COVID-19 cases have been reported in Georgia today. It is one of the largest single-day increases in the state since the pandemic began. Reveal investigator Andy Pierotti explains why testing isn't the only reason for that spike and who's most at risk.
COVID-19 is still a very real threat in Georgia, with average cases increasing over the past 10 days. Georgia State University epidemiologist Dr. Harry Hyman explains.
Around the time we started declining as a result of closing down businesses and requiring social distancing, we started reopening the state.
Local officials, including Governor Kemp, attribute increases to more testing, but that's not the only reason.
Our testing has been stable for some time, and what we're seeing is a persistent high level of COVID-19 cases as a result of continued community spread.
The goal now, Hyman says, is to focus on protecting people who are at high risk.
Older people and those with multiple chronic diseases are at higher risk for not only contracting COVID, but having a more serious case requiring hospitalization and being at risk for death as a result of COVID.
In fact, long-term care facilities account for 45% of all deaths in Georgia.
COVID-19 has had a disproportionate impact on communities of color, especially the African-American community.
The best strategy to protect those at risk? Targeted testing.
It means making sure that there's access to walk-up, not just drive-through testing in neighborhoods, not only across urban areas, but also rural areas of our state.